Very good morning. Can you hear me?
Morning, Prof.
Can you hear? Okay. How are you?
Good, Prof.
Fine,
All
Prof.
take care because now the cases is increasing, and it seems that in terms of contact with the COVID, quite a number of people, whether it is a direct contact or maybe secondary or tertiary. So all take care. Stay at home. Although we know that you are still very young, can consider highly resistant, but yet take care just to ensure that we can stop this of COVID chains. Otherwise, the infection won't stop. If there's many people get exposed. So take care and please stay at home. Okay. So even today, so I'm from home actually. So we're going to have a lecture this morning, and then we follow up with our practicals in the afternoon at 2 o'clock. Thank you very much. I received your case study. So this practical in the afternoon, we cover the intestinal tract. Then after that, we follow up with, we have also a second tutorial. But more importantly, in the afternoon also, we're going to discuss those answers that has been given. Although probably I cannot go through all, I might give some example, look a few. Then from there, we discuss what is the expected answer that you should have from those other questions that given to you. Because I do realize that some of you, yeah, you have all the points, but yet sometimes in terms of the expected answer, it might not be there. And please remember, this is open book. That's why I just appreciate in the way that even in open book, sometimes the answer given, not to say you don't understand, but the answer given is not really 100% and or maybe nearly to 100% what is expected. And so when you go through the answer, then you can have better understanding, and then you can see what is the expected answer it should be. Yeah. So this is something that, although at the end of the day, the most important thing is a knowledge, whether you get that knowledge from the case that is given to you, from the lecture that given to you, from the exercise of the practical that given to you. So the case study will try to do a self-assessment in terms of understanding of the lecture. And in my part is that in terms of how I could deliver a lecture that you can understand. There are two ways actually. I'm assessing yourself in terms of my understanding, but at the same time, I'm assessing also myself, actually how much you can understand from whatever lecture that given to you. So both of us will benefit of this exercise. Of course, the long term will be when you practice later on, that what we will expect you to have those competency and skill. Yeah? When you look at a case, you may be able to think something that is beyond the normal people, but as a veterinarian, and probably more focused also towards as a pathologist, although you're not a pathologist, but try to understand those spirit of the pathologist. Okay, so that will be in the afternoon. I think that's very important. That's why I have a case study, because to me, I always believe that yes, the student have knowledge, you know, but sometimes also in terms of the approach, perhaps need to be improved, so that in terms of delivery on my part, I do my best to ensure that I can deliver well, then you can understand. And in your part also, we believe that we want you also to, what you call it, able to deliver. And one way of looking that, we do our self-assessment, and those of the self-assessment is based on our case study. So our lecture 6, mainly on the pathophysiology of enteric diseases. Yeah, you remember that we have pathophysiology of gastric diseases. We just complete with our diseases of the intestinal tracts, yeah, all those diseases, and more importantly also of the lesion, particularly on enteritis. Then follow up with villus atrophy. Same thing also, we do have also one of the important clinical sign or condition in cases of GIT intestinal diseases is a diarrhea. Okay. Can you see the slide? Yeah? Why is not? Sorry, they don't move because I opened that one. Okay. Yeah. Oh. And, okay. So for this pathophysiology, I mentioned earlier, one is enteric diseases. And remember that of the enteric diseases, apart from the agent itself, when you talk about diseases, we are talking about a disease, and that disease caused by the agent. But more importantly, also when you talk about pathology, when you talk about enteric diseases, so the focus also a lot on the lesion. And you remember that there are 5 types of lesion in enteritis, as well as you can see stomatitis to have 5 types of lesion. So this is important when you talk about enteritic diseases, because the agent caused that lesion, and the formation of that lesion lead to functional abnormalities. And one of the functional abnormalities, clinical sign shown is a diarrhea, and at the end of a functional abnormalities is a death, isn't it? And that death is actually due to the failure of vital organ as a result of the formation of lesion in the intestine caused by agents. Okay. And the second part is villus atrophy. This is very important because if you look at the structure of the villi, there are more fingers-like projection with single cuboidal or columnar epithelial lining, and damages of the epithelium of the villi, or probably the crypt or liberum, caused by agents. With agent are some specific cause damage of the crypt, others are specific cause damage of the villi epithelium, that lead to shortening of the villi, and this shortening leading to what a condition caused as villus atrophy. And this villus atrophy will interfere with the normal function of the intestinal tracts. Then the third one is on diarrhea. I remember that we have 4 different type of mechanism of diarrhea, although at one time, all or either 1, 2, or all those mechanisms might involve, depend on the agent. So this is something we have to understand. So in terms of this pathophysiology of the diarrhea, one of the important condition or clinical sign with regard of enteric diseases. So as a result of those, diarrhea, villus atrophy, enteric diseases, they interfere also with acid-base equilibrium. So they will interfere with acid-base equilibrium, and this acid-base equilibrium could lead to the metabolic acidosis, metabolic alkalosis, and loss of fluid might cause also what we call it hypovolemia, isn't it? And all this will lead to imbalance of the fluid in the body or the pH of the body, and that also can interfere with the normal function of the body. Okay. So this is an example on the enteric diseases. You remember the enteric diseases might cause what you call it 5 different type of lesion, and those lesion could lead to, one example is villus atrophy, villus atrophy, or in cases of as a result of enteritis. So as an example here, when animal have a villus atrophy, of course they will alter in terms of process of absorption. Yeah. So the villi become shortened, and then of course the epithelial lining of the villi is become less, and then the function of the villi, one of the most important is what we call it absorption. So there will be malabsorption, maldigestion. There's tendency also, depending on the agent, they might have also hypersecretion. And worse condition, when this malfunction also involved with the protein and electrolyte losses, which lead to fluid hemostasis, loss of sodium, calcium, acid-base homocysteity, and occasionally have involved with hypermotility. So this is one of the most few of the what we call it condition as a result of altered function of the intestinal tracts or the intestine. Yeah? And the clinical sign you observe, one of the most prominent one is diarrhea. Vomiting is possible, dehydration because loss of fluid, shock also because of loss of fluid, and because of maldigestion or malabsorption, so animal will lose in body weight, and this is not good with regard of producing animal. Animal might have anorexia, hyperventilation, and depending on the severity and type of lesion, animal might have also abdominal pain. Just take note that I think this is not that very important, that they also are seen in exocrine pancreatic insufficiency, nutrition, and hepatic diseases. So this is a flow actually. When you look there, when you're enteric diseases will lead to what I call it enteric diseases is mainly due to the agent, isn't it? So they started with the agent. Agent enter the host, then the agent will multiply in the cell of the intestine. And when you look at the cell of the intestine, they comprise mainly the enterocyte or probably goblet cell. Of course, the enterocyte is more important. And that will lead to enteritis. And you remember that we have 5 type classification of enteritis, then leading to malfunction and showing a clinical sign. That is what we call it as a pathophysiology. Of course, the end of clinical sign is death. When animal have villus atrophy again, I think our previous lecture villus atrophy is only one slide. So, as we aware, the shortening of the villi can be as a result of loss of the surface enterocyte. I mean that the loss of enterocyte at the villi itself, or it can be also loss of pregnatal creep cell, which is where the cell is multiplying, mitosis occur there, and this cell at the crypts will replace and become mature when they travel up into the what we call it the villi. And this shortening, remember the agent that can cause losses of superenterocyte is something quite specific. For example, the surface one can be a coronavirus. Losses of pregnatal cells are very specific. For example, we have parvovirus, cause losses of pregnatal cell. And as a result of that, of course, both, whether it is loss of the villi itself or loss of the creep cell, that will reduction in a surface area for absorption. They also increase in cellular immaturity. Usually, the cell is more immature and will decrease absorption function as well as decrease of the digestive function. So both, of course, this can lead to a diarrhea, and the mechanism of diarrhea can be osmotic diarrhea, depending on the agent also. Depending on the agent, we might have those different type of diarrhea. Okay. Another one, but lead also maldigestion and malabsorption is hypermotility. I remember that hypermotility also is one type of diarrhea, isn't it? So the intestinal tracts contracted more frequently. Although this only small factor leading to diarrhea is not a major factor, but when there's an increase in peristalsis, there's increase in intensity, frequency, and rate of progression. So increase in peristalsis. This is quite common also in hypermotility, and sometimes also might as a result of allergic reaction. Yeah. And the common treatment they give usually is to reduce those of the contraction of the intestine. And when you can diagnose this and identify this, if you use a stethoscope and you heard the sound and count the motility of the intestine. So the excreted transit of the data into the intestine, so the reduce in mucosa contact time, of course, they will lead of maldigestion, malabsorption, and they have, again, most likely diarrhea as well. Another one is the permeability. You remember that we have a classification of enteritis. We involve with fibrinous enteritis, fibrinous enteritis. This as a result of increased permeability of the blood vessel. So there will in the endothelial cell injury or dilated, so there will be increase in pore size. As a result of that, there is increased permeability lead to protein loss because in normal condition, blood, creatinine, fibrin, all is safely present in the lumen of the blood vessel. But when the disturbances in the endothelial cell, whether direct injury or indirect injury, so the pore size increasing. I think in the intestine, they might lead to hemorrhagic enteritis, or they might lead also, I mentioned earlier, fibrinous enteritis. So a small increase, only a large passage of small molecules like creatinine and fibrin. So that might lead to fibrinous enteritis. But it is a large increase. They will allow even albumin, which is much more bigger. And when this albumin escape from the blood vessel, so animal we have low protein in the blood. And that condition, we call it as a hypoproteinemia. And animal we have condition called protein losing enteropathy, meaning animal lost the protein from the intestine. So protein losing enteropathy. And as a result of that, when animal have lost a lot of protein, so there will be loss of protein in the blood vessel. They have hypoproteinemia. And when they have hypoproteinemia, they will invite condition called edema. And the edema is a generalized, but commonly seen particularly in the lung. So this is a normal mechanism of edema, where in this case, when there is less of protein in the blood, so the blood osmotic pressure is reduced, osmotic pressure reduced, even at the condition of blood pressure, because edema is something to do with blood osmotic pressure, blood pressure, equivalent to tissue osmotic pressure and tissue pressure. If there is drop in blood osmotic pressure, which is commonly due loss of albumin or protein, so whatever fluid that been enter into the cellular space, particularly in the lung, they are not able to go back into the blood circulation because the what you call it, imbalance of those pressure, pore pressure, blood osmotic pressure, blood pressure, which is in the blood vessel, and the tissue, we have tissue osmotic pressure and tissue pressure. So once the blood osmotic pressure is dropped, so fluid that been enter in the cell are not able to go back into the circulation. So that's why we see edema, and this is more common in the area where they are more spongy, the spongy like in cases of the lung. And this losing enteropathy, you remember one of the example, jaundice disease, where the gross lesion of jaundice disease, you can see thickening of the epithelial lining of the intestine with a transverse folding. That also lead to escape of what you call it, protein losing enteropathy, as well as in cases of chronic hemochromatosis. But if it is very large size of the blood, we will escape. They might involve also, I mean, the pore becomes so big. That will also escape of fibrin leakage, leading to fibrin clot. And in severe cases, might involve also escape of RBC and leading to hemorrhage. In advanced stage, they might be endothelial and epithelial rupture and slough off. As a result of that, large amount of fibrin clot and whole blood are present in the lumen of intestine. This particularly when involved in infection, for example, of salmonellosis, Clostridium perfringens, as well as example there is coccidiosis. Because apart from changes in the endothelial cell is epithelial lining of the blood vessel, but there is also epithelium or the simple columnar or cuboidal epithelium of the villi necrosis, then leading to slough off. That's why they got a lot. There's some people in there, but at the same time also you can see might be blood and necrotic tissue. Any questions so far? Class, do you have any questions so far? Yes? Hello?
No, Prof.
No, yeah? Okay.
No problem.
I just want to see something. Okay. No, yeah, so far, okay. I drive very slowly. I just teach, the lecture is very slow. I didn't go very fast. And this is a systemic effect of diarrhea. Example there, protein losing enteropathy because lost a lot of fluid. So in cases of diarrhea, when there's acute, the immediate cause of diarrhea acute is dehydration. That's why when animal or even patient or human being have very severe diarrhea, so you need a supplement with fluid, isn't it? So animal is on IV drips because the effect is dehydration, and severe dehydration can lead to death. Not joke. Although it's very simple dehydration, but severe dehydration could lead death. In symptom term, animal will die of hypothermic shock. Yeah. So when animals have diarrhea, they loss of carbohydrate, they loss of bicarbonate also, and this lead to metabolic acidosis. I mentioned in the previous lectures, when animals have metabolic acidosis, they will interfere with the cardiovascular system, and acidosis condition also could lead to damages of the vital organs. Yeah, so that will lead to death. But when the dehydration is very acute, of course that lead to drop in blood volume. The blood volume in the body will be drops, then leading to again low venous return, and low venous return meaning that leading to low cardiac output, meaning low oxygen as well as nutrient supply in the organ, particularly involving the vital organ, the central nervous system, and there will be, as a result of that, is ischemic necrosis of the central nervous system that might involve of the respiratory center as well as probably cardiovascular center. And failure of those center will involve cardiovascular, respiratory, and central nervous system, leading to failure of the organ and leading to death. Okay, so the cause of death normally is associated with reduction in cardiac output. I think that's quite standard. The cause of death very quite standard is as a result of what you call it, a reduction in cardiac output. Although people will ask, is it which one come first, the failure of the heart or failure of the brain? Yeah. So of course, normally when you want to confirm animal die, usually they look at the blood pressure and the heartbeat. Yeah? So probably that will be last what you call it drops, because probably you cannot monitor what you call the brains. And when you put animal under anesthesia, normally you monitor in terms of death or anesthetic based on the nerve response, where the peripheral nerve or central nervous system respond, that you understand that at what level of anesthetic condition the drug that you give to the animal, whether they are too much or just nice. Yeah? So those play important role in our practice. With regard of the fluid imbalance, so it need to be balanced, yeah? Meaning that they need to hemostasis, and this might involve the extracellular fluid as well as intracellular fluid. Yeah? So in cases of isotonic fluid loss, this is more seen in diarrhea due to malabsorption. Okay, due to malabsorption, of course, when hypotonic loss in asthmatic diarrhea. Yeah? So an example of isotonic fluid loss, where actually the proportion amount of water and fluid are lost, and this is only as a result of reduction in extracellular fluid component, meaning that the plasma osmolality is normal. It will be increased in serum protein and packed cell volume, partly because the blood or the fluid in the blood vessel is becoming concentrated. That's why you can see that serum protein and packed cell volume is increased. And when this happens, the compensatory mechanism involved with low cardiac output, then low renal blood flow. As a result of that, when there's a low renal blood flow, there will be low, we will study later on the glomerular filtration rate. Yeah? I think next semester you will study the urinary system, and you get to understand later on with regard of the renal blood flow, as well as glomerular filtration rate, GFR, glomerular filtration rate. And reduction in glomerular filtration rate will, what you call it, invite aldosterone, will lead to increase in sodium reabsorption from the renal tubule and water retention. So with that water retention, they will balance what you call it, a dose of the reduction of extracellular fluid component. So this is more of isotonic fluid losses. I think, and then in terms of hypotonic fluid losses, they lost more water than fluid, and they will drop both of the fluid in the extracellular fluid as well as in intracellular component, means water in the cell. So the water seeps from the intracellular fluid component to the extracellular. And they might have osmotic barium to bring. And in this case, of course, you can see the seminal osmolality to be normal, partly because of those osmotic equilibrium. And the compensatory mechanism involved, we involve in volume receptor or as well as homoreceptor stimulated, increase antidiuretic hormone, and attempt to bring more normal osmolality and volume. Again, ADH also play important role later on when you have in your endocrine as well as in your urinary system. Okay. So as a result of changes in acid-base equilibrium, there will be loss of acid-base hemostasis. I mentioned earlier the cellular acidosis. There will increase in packed cell volume, BUN, and what I call it plasma of potassium. Yeah? Again, there's a renal failure. I mean, there will be renal disease when we discuss later, not only involved with GIT. And then the extracellular acidosis, probably due to excessive secretion of bicarbonate, absorb or acid from the gut, and anaerobic respiration, metabolism of skeletal muscle, this lactic acid. Example of, this as example, but something to do GIT is mainly involved with this secretion of bicarbonate. That's why we have extracellular acidosis, because animal lost a lot of bicarbonate. So there will be more acid present in the gut. So in cases in the body, presence of E. coli diarrhea. So intracellular acidosis, the composite mechanism involved actually the exchange flow of the extracellular fluid and intracellular fluid. They will increase in the hyperkalemia, intracellular acidosis that might lead to cardiac toxic and lead to cardiac arrhythmia and animal might die. Okay, don't worry so much on this. I think this is some combination where they involve with GIT and they involve also with other body system. When you go to large intestine, I think not much different actually when you go to large intestine and the small intestine. The only difference you remember in terms of the histology of the large intestine and small intestine, the villi in small intestine is much more taller or longer, as well as the crypt. The number of enterocytes also small, with less number of gallbladder cell. When you compare the histology of the large intestine, because large intestine, in terms of the villi, they are shortened. Internal gallbladder cell, they are much more in number. So in principle, those changes are similar to that of the small intestine. For example, diseases in colon, they might alter function because colon have very important process of absorption, but one of their role is to absorb water. Yeah? So to make sure the feces will less of fluid. So alternation of the function of the colon, one of the most important thing you can see is diarrhea, because fluid is not able to be reabsorbed. And as a result of that, animal will get dehydrated. And in severe case, of course, that will lead to shock, hypovolemic shock. Because in normal condition, large amount of fluid reach the colon and they will be reabsorbed. And in terms of critical in maintenance of fluid hemostasis, it is about 30 liters per day in 100 kg animals. That colon deal with the fluid there. Water reabsorption is a function of colon, and you can see that in cases of diseases in colon, of course, they will interfere the function of the colon as a result of present or lesion in the epithelial lining or maybe submucosa of the colon. That lead to what I call it conditions. For example, the protein losing enteropathy. As example, in cases of salmonellosis and jaundice. In cases jaundice, I think to me is something that is more clearly because the folding of the epithelial lining as a result of infiltration of inflammatory cell. We'll show you the slide in the practical later on, or even you saw it during the lecture previously. And that lead to failure of reabsorption and leading to hyperproteinemia, and animal might have generalized edema. And failure of reabsorption leading to diarrhea. And in cases of jaundice, animal will have jaundice disease, animal will have shooting diarrhea, where the fluid of diarrhea contains a lot of fluid. Any question, class? Are you all okay?
Okay, doctor.
Yes,
Okay,
Doctor.
you're looking for lunch, Wait, don't worry. At home is okay, you have good food. Compare in college, yeah. Okay, be careful, put on weight. Okay, so systemic diarrhea. Again, the same also, a similar effect of small intestine. So when there is a damage of the, what you call it, the large intestine, in acute form, I call my diarrhea, dehydration, reduction in blood volume, cardiac output, short and death. It was same, okay? But probably in long run, same also in chronic, they might have chronic protein losing enteropathy. I think you can understand how this chronic protein losing enteropathy occur, the mechanism. Okay. Hey, we are there. Any question? We are 12:40 now. We have a few more minutes to if you got any question to ask with regard of this or maybe other matters also. Ada soalan tak? Yes, class. Before we see you again at 2 o'clock.
No from me, Prof.
Tak ada ya? The rest ada tak soalan?
Okay, Prof.
Kalau tak ada, we thank you very much. But you got anything, of course, what you call it, you can ask later. We're going to spend this afternoon maybe about the same time, maybe 1.5 or maybe 2 hours, pending on the what you call it, more on the case study. Because I think I would like to get more feedback from you with regard to case study, because I mentioned earlier that case study is more of a self-assessment in yourself. I want to see how much you understand. In my part, I want to see how much I could deliver my lectures that you can understand. So both of us are looking forward of that. Okay. If you don't have any question, we have to adjourn our class now, and see you again at 2 o'clock. Is it okay?
Yes, Prof.
Okay. So thank you very much, and see you at 2 o'clock. Okay.
Thank you so much, Prof.
Thank you, Prof.